Welcome to our training. Today, we're going to talk about the very first aspects of an in person meeting that we might have as agents with a client. This is going to be part one of a four-part series that's designed to go in depth, teaching you those steps that you need to take in order to take really good care of the clients that you're going to interact with. You're going to see on my screen today, we're going to go through part one of a guide that we've prepared for you. Once we've finished with all four recorded sessions, we will have a copy of this guide available for you and actual recorded YouTube versions of the webinar that we're doing here today. This guide will be fully updated and available. It'll be a really nice PDF document that you can have available all the time to walk you through the basic steps from before the enrollment meeting all the way through the enrollment meeting and things that you should do as an agent following the enrollment meeting. That's what we're going to go over today are those steps that you should take before the meeting. And that sounds a little strange, right? Why would we need to take steps before the meeting? This might be one of the most important things that we do as agents. The work that you do before the meeting can have huge implications in terms of how efficient that meeting goes for you and your client, how effective you are as an agent, and it can give you access to information that can help you better prepare to do a good job meeting with that client, especially if they have a complex case. Generally speaking, if we're going to present Medicare plans and their benefits, we have to have a completed compliant scope of appointment from that client 48 hours prior to the meeting. How do we do that? We're going to show you this real time in a little bit in Smart Enroll. We have the ability to send that digitally. We can send it as a text message to our client's phone. They click a link and they can complete that form. We can also send it to their email address. Again, they click a link, they complete a digital form. And within Smart Enroll and on our agent website, Agent Hub, we have a paper PDF version that you can download and have people fill that form out the way that we always used to complete forms. So there's many, many ways that we can collect that scope of appointment. It's just important that we actually do it for every single meeting. Where might you be questioned about that scope of appointment form? Well, 2 years ago, I did a phone enrollment with a client, and that carrier did a random audit on my interaction with that client. They made me provide them with all of the phone recordings. They made me provide them with the compliant scope of appointment form and all the different application information that I help that client to complete. This is why it matters. We want to do things by the rules and by the letter of the law so that if we ever have to provide that information, be it a sales allegation or just an inquiry or a random audit by a carrier like I experienced, we can confidently say we did that meeting the right way. And that's exactly what we're going to teach you in this four-part series. So, one clarification on the scope of appointment form. How do you handle it if that client just walks into your office today? Maybe you're in your office, you're on your phone, and you get off the phone and somebody says, "Hey, there's a client here that wants to talk to you about their Medicare benefits." Under that specific case, you're exempt from the 48-hour rule. You can still meet with that client, but we're going to want you, and the rules are going to tell you that you still have to have them fill out that form. You're simply going to note on that form that that client was a walk in and the date that they walked in. So you do have some exemptions. There are others that we're not going to get into today, things that center around the last couple of days of an enrollment period, but we'll teach you all that in our compliant workshop that'll be coming up. So in the guide, you're going to find a video tutorial that will show you how to complete that Smart Enroll application. And I'm going to show you how to do that in this session very, very shortly. Last thing on this slide, how long do you have to maintain the scope of appointment form for each client? So you have to keep it for 10 years plus the year of the enrollment. And you can keep that form. If you do it in Smart Enroll, the beautiful thing is Smart Enroll keeps that for you. So I'm also going to show you how you can upload a PDF form that maybe someone filled out in your office into their file in Smart Enroll, that compliant form is maintained there for that client, and you don't have to worry about keeping track of that record. Very, very important disclaimer here. Please do not try to bend the rules. If someone's not a valid walk-in, don't say that they are so that you can skirt the 48-hour rule. Your clients are going to respect the fact that you follow the rules. I know it's inconvenient for someone to have to wait 48 hours, but that's okay. We want to follow the rules and we want to make sure that they understand that we as agents, even though so many don't, that everybody that works with TLC follows the compliant rules to the letter of the law. So, like we said, we want to get that compliance scope of appointment form 48 hours prior to the meeting. If you have that walk in, you still complete the form. And in this guide, as well as on our agent website, as well as in Smart Enroll, you're going to have access to a paper PDF version of the scope of appointment form. What I like to do is at the point of scheduling the meeting, this could be you, this could be somebody in your office. When I schedule the meeting, I like to go ahead and send them the link to complete that scope of appointment form. It's really easy. And when we get into the Smart Enroll application here, I'm going to show you how it works. Because one thing that I would recommend is as you send them that link, you just stay on the phone with them. Don't leave it to chance that they're going to be able to go do that on their own without any questions. Stay on the phone, have them open the link, and stay with them as they complete that easy to fill out scope of appointment form. Because if you don't and they have a question, they have to call you back. And if you're tied up, you now have to call them back. And you're creating a situation that's inefficient. Take that 3 or 4 minutes, help them complete that easy to do form either by text or by email, and we'll demonstrate that shortly. Also, this list of information right here are things that you want to advise them ahead of the meeting. If you don't, very likely you're going to get into that meeting and you're going to have a question or you're going to be looking at their plan. You're going to be missing information that you need in order to best advise them. So, number one is their red, white, and blue Medicare ID card if they have it. That is paramount. We want them to bring that. We don't want to trust the napkin that they wrote a number on that looks like a Medicare ID. We want to see the one that they got from the Social Security office with the official red, white, and blue design. We want to see a Part A and a Part B effective date. We want that information from the card. And there's one big reason why, other than the fact that if they write it down, it might not be right. We want to make sure to match how their name is presented on the Medicare ID card to any plan applications that we do. Why? As all this coordination takes place with Medicare, the last thing we want for our client is a conflict between their name or the spelling of their name or their legal first name between their carrier plan and Medicare, the federal entity. So that's really important. We want that card in hand. We also want a list of medical providers, their names, and the address where your client goes to them for care. Something that I like to do, a lot of providers and hospital networks now have a software application, something like MyChart and others. If your client can go in there and print off a provider list and a prescription list, that can really help you in these meetings. But we want that list of providers. If they're not good at writing it down, it really does help to have access to that MyChart list. And then, really, perhaps most importantly, where we really need accuracy is with prescriptions. A lot of people are going to want to bring you a list, which is okay. But again, we're now assuming that that client wrote everything down. They wrote it down correctly. They had all of the names of that specific medications and the different types of medications detailed accurately. They had the dosage right and they had the frequency right on every medication on that list. My preference as somebody who still meets with clients is to have my client put all those pill bottles and boxes into a bag. Bring that to the meeting with me. Let me physically hold that bottle, read that label, enter that into Smart Enroll, and then I can move. What I really like about it is I can move each prescription from right to left across my desk as I go, making sure that I got every medication that my client needs entered into that list. I can't tell you how much time that simple step saves me over the years between the people that bring me their pills in a bag versus the people that make a list, because inevitably they're going to leave off information that you need to know. A final reminder is that preferred pharmacy name and address. We'd like to know where our clients currently go to get their prescriptions filled, and maybe perhaps a few other alternatives. That way we can be really good at giving them their options in the quoting process. So let's talk about some really important pre-enrollment agent procedures. So number one, we do need to verify that our client is in fact eligible for Medicare. There's a couple ways that we can do that. We can do that in Smart Enroll, which I'll show you. But the easiest way is to have them bring that red, white, and blue Medicare card. We want to see that in hand. If they haven't yet applied, we have other trainings that will walk you through how to help them with that Medicare application process. And what very often happens in this industry, you might meet with somebody who is 64, and then 3 months out, they're applying for Medicare Part A and B. And now we're waiting. So we've met with them 3 months before they turn 65. We directed them on how to apply for Medicare A and B, and we're in a holding pattern until they get that card before we can put them into a med supplement plan or a Medicare Advantage prescription drug plan. So we are in this timeline of advising about the basics of Medicare, teaching and coaching clients on the ways that they can apply for Medicare A and B, advising them if perhaps they have automatic enrollment. Maybe they're getting Social Security benefits already 4 months prior to turning 65, and they're going to be automatically enrolled. So we're an integral part of that process in making sure that we keep track of them over that continuum of time. Another really important thing to verify is whether or not they might have Medicaid. As you all know, there are special plans designed for individuals that have Medicare and certain varieties of Medicaid. We want to make sure we have that conversation in our meeting, and it's helpful to have that before the meeting. If they say they're not sure, just tell them to bring any letters that they have from Medicare in the state that they live in to your meeting about their health care coverage. And you can kind of go through that with them. Lastly, make sure that they do not have access to a retirement plan, right? A Medicare plan option through their employer or a union group. So you might see this with your state employees, your firefighters, your police officers, your teachers, your United States postal workers. Veterans have multiple coverage pathways that they may have access to based on their years of service. Some employers, large employers, actually have group Medicare plan options available for their retirees. If they say yes, that doesn't mean we cancel the meeting and say, I can't help you because you have a great plan through your employer. What it does mean is we prompt them to bring whatever information they can to that meeting to help us do a comparative analysis of that employer plan alongside their options that are freely available to them. If we don't have that conversation when scheduling, we're leaving it up to chance. And so we can be halfway through a meeting, spend 45 minutes with an individual, find out that they have access to an employer plan, maybe a monthly stipend amount that they get. And if they leave that plan, they lose that stipend amount. We want to know that before we sit down rather than halfway through a meeting, potentially wasting their time and ours as brokers. But again, we never want to say, yes, you have that coverage. We don't need to have a meeting. Because here's the really big disclaimer. Even if their employer or union plan is incredible and is good for them as the individual, very often it's not good for their spouse. And we as agents can still help their spouse and other friends and family members with their options. So here are some resources for you to help with that. There is a enrollment period verification link that we put here from Medicare.gov. And then there's also a link to a client management form that we often use at TLC. I'm not going to open it up right now because it's going to knock us off the screen, but it's just a simple background information form where we get the demographic information from the client and we write their plan information on that form so that we have that to enter into our client management system, or if you're a new agent, into a simple spreadsheet to help you keep track of your clients and your enrollments. I'll try to show you that form a little bit later on in the webinar if we have a chance today. So, as we said a moment or two ago, there is a chance that that individual may not have Medicare A and B yet. And so I already talked about this, but if they're already getting benefits from Social Security or the Railroad Retirement Board 4 months before they turn 65, they're automatically going to be signed up for Part A and Part B. That's going to happen on the first of the month or their 65th birthday. They should get their Medicare ID card in the mail several months before that birthday month. Okay. Since Part B has a premium, they will be given a packet in the mail with the option to maybe defer Part B. And they might choose to do that. We have many clients who are going to work past age 65. So at age 65, they take Part A and they defer Part B because they have credible coverage through a health plan, or on a health plan rather, through their employer or their spouse that meets their needs. That's really the key word. If you have a client who's asking you about working past 65, don't ever please just say, well, you have an employer plan or your spouse has an employer plan, so you're covered. Always put it back on them to go back to the employer, make sure it's credible, because if it doesn't have important things like drug coverage, or if it doesn't cover certain, well, what do we call those? I'm going to forget because I'm in the middle of a webinar. They are the preventive care. If they don't have certain preventive care things covered a certain way, it might not meet those federal guidelines. We also don't want to, again, leave it to chance that that employer plan is better from a cost or coverage standpoint from what we can potentially show them that's available to them in the free market. So, very important steps there. How do they apply for A and B? A couple of ways. And there are agents that help facilitate this process. They'll go online with clients and help them do an application. If you're a new agent or you've never done that before and you've had no training, please do not embark on that without having training and deeply understanding what you have to do to apply for Medicare online. You could inadvertently help that client apply for Medicare. And like I said, inadvertently also sign them up for retirement benefits, which they might not want at that given time. So that's not something that we want to do as agents. Unless we're really trained and really comfortable. But they can apply online. They can apply by phone to the national number, call and set up a meeting. There's a number to call for the Railroad Retiree Board. And approximately 2 weeks, depending on their local Social Security office, after they apply, they will get their Medicare ID card. It's not on this slide, but they can also contact their local Social Security office to request a meeting locally in person to do their Social Security enrollment. That wasn't the case during COVID, but many Social Security offices now allow those in person meetings here again. So, with that, we're going to segue out of the slides and we're going to jump into our Smart Enroll demonstration here. So let me get this set up for you on the screen. And we'll show you some steps that we take, again, at that point of scheduling. This is prior to the meeting for Medicare, and it's how we help our meetings go really smoothly. So I'm on the phone right now. A client called in. We talked through some of those things that we just talked about. I gave them a list of items I'd like them to bring to the meeting. And I'm going to just jump into Smart Enroll. This is what the screen looks like for those of you who maybe not seen it yet. And I'm just going to go ahead and click over here on New Profile. And I'm going to go ahead and click New Beneficiary. And what this is going to allow me to do is go ahead and enter in some upfront information. I'll drop my zip code here. I'm going to put my name. I'm going to put my date of birth. I'm going to make one up so that I can actually maybe be closer to Medicare age. And then I can enter their email address. I'll do that right now. I can go ahead and enter phone number. And that's all the information I really need to enter right now. But because I know I want a scope of appointment, I'm also going to add the address. If you do not add the address, your client's going to have to do that when they're in the process of completing the scope of appointment form. We'd rather them to have to enter very little so that while they're in the middle of that process, they're not fumbling around. It's okay for you to experiment with this. Send yourself the form every way that you can. Create a profile for yourself, send it to yourself by text, by email, and do it multiple times if you have to. Learn how to go through the process that your client's going to experience. For now, I'm going to click save down here. And so I've gone and filled out that profile information. I've saved it. Now, we talked about Medicare ID number eligibility checks. We can put their Medicare number in here. We can put their Part A and Part B information in here. And then we can do an eligibility check. It works most of the time. There have been times where these have gone down in every platform in the country, but it's one way that we can confirm that our client is actually eligible for Medicare. But for now, I'm going to go to the bottom and we're going to go ahead to complete scope of appointment. Continue to SOA, scope of appointment. And now that I'm in here, since I already added that email address and phone number, I can go ahead and click text and it will send that link to my client. It's automatically going to pop up with this, which is going to add a task for me. If I click add task, if I don't want it, I can click close. But I want to add that task and I'll show you why here in a minute. It's a good reminder for me to follow up. In addition to that, we also have a printable consumer form here. If that client is a walk-in, I can print this PDF form out. They can fill it out in the office. Very, very easy to complete, right? And then once that PDF is filled out, I can go ahead and click upload here and pick that PDF document. And now it's going to be saved for that 10 plus years right here in my profile. I want to show you something real quick. I'm going to go ahead and email myself the scope of appointment form. Give me a second and it's already here, if you can believe that quick. Let me open this email. So here it is. So you can see now I got my scope of appointment form email. And it says, "Hi, David, I'm looking forward to meeting with you. Go ahead and complete scope of appointment form." It has a little video at the top, which is new. I haven't actually seen this yet, so I'm going to have to go watch this back myself. It explains the scope of appointment form. And this is what I want to be able to tell them on the phone. Go ahead and check all products. That gives me the ability to talk to them about all of those products in our meeting time together. You can see because I entered my client's mailing address that's already here, everybody gets confused by the authorized representative question. You're only going to have clients filling that out in the event that they are acting on behalf of someone, meaning they have power of attorney over somebody. So in the vast majority of cases, that's going to be a no. They click this little signature box and then they submit the form, and my compliance scope of appointment form is complete as a client. It's really great on this pop-up screen. It reminds them to bring those items that we taught you to tell them to bring just a few moments ago. Now back in that client profile on Smart Enroll, let me do a quick refresh. You will now see that it tells me that that form was completed on 8/5, and then I have to click complete as an agent. I have to put in a method of contact. I'll just put current client. Let me type. I'll just leave that for now. And then I also have to check the 4 plans options rather. And then I check the box. and I submit the form. And so now we have a completed scope of appointment form that's going to be saved in the system for 11 years. I can view it by clicking right here and downloading a PDF version of that file if I want to print that out and maybe keep it in a traditional file storage um, setting. So if we walk our client through that on the phone, we know that it's finished. If not, when I go back to the dashboard, remember I said about that task, how it will allow you to create a task. You're going to see on my dashboard down here, I have tasks that are created through that smart enroll process that we went through. So again, that's kind of how that functions in terms of being able to create a scope of appointment. Super easy. We want to get that done. We want to get that done compliantly, and we want to have it on hand ahead of that enrollment meeting. So let me go back to that profile real quick. So something else that you can do. So on every client, you're going to be able to see a task list and you're going to be able to see a notes section. You can add unlimited tasks and notes here if you choose to. Maybe you need to put a note that says follow up about their Part B application. I can put that on every client that I'm working with. If we sent those things into Social Security, I'm waiting to know when they're ready. I can put a note, or if I set that as a task, it's going to have a date reminder when I first log in on that dashboard screen. So you can do this in the meeting, or you can do this ahead of the meeting, depending on how much time you have on the phone with your client. You could potentially add providers, pharmacy information, and prescriptions on that initial call. So I already have some added here, but I could add more if I wanted to. So maybe I'm updating my client's profile. Maybe this is a client who's coming in for a review and I want to go ahead and update this information. I can look up a doctor right here and go ahead and add that doctor prior to our actual in-person meeting. Just go ahead and click and add the address, and now I've added that position. Same is true with pharmacy or prescriptions. We very typically wait until the meeting to do these things, but you will have the ability to do that at the point of scheduling if you so choose. So, quick recap. Let's just go back here. Number one, we want to make sure that we get the compliance scope of appointment 48 hours in advance. We do have an exception if they happen to be a walk-in, but we're not going to fudge that situation. We're not going to falsify whether or not they were a walk-in client or not. And so we can do that electronically. We can do that by paper. We just have to make sure that we do it. We're going to provide our clients with reminders at the point of scheduling, in addition to helping them complete the scope of appointment. We're going to remind them to bring that Medicare ID if they have it, that provider list, a prescription list, or the actual medication containers themselves, and a preferred pharmacy name and network list. If they don't yet have Medicare, we are going to go ahead and give them the information that they need on how to sign up for Medicare. Again, if they are getting Social Security benefits or Railroad Retiree Board benefits 4 months before they turn 65, that'll be an automatic enrollment. Otherwise, we have to give them this information. They can either apply online or contact Social Security at the federal 800 number or their local Social Security office. Those are the minimum things, the minimal things that we're going to do before we sit down to have a meeting where we talk about plan benefits. And last but not least, because this happens more than I'd like to admit, make sure you give them really good directions on how to get to your office or whatever meeting location you're going to meet them at. Here's why. Our office, where we've had a lot of client meetings, historically is hard to find with GPS. It was in a newer area and the pins weren't all right on all the different GPS navigation entities. We had to submit appeals to try to get those moved because we wanted people to be able to find us. Give really clear directions. If your location is hard to find, maybe even make your own little uh, easy guide and send that as a courtesy. Number two, you have to remind folks, and you can do that through multiple ways depending on how your agency's set up. If you use a lot of technology, that could be a text reminder, which our population that we work with is actually very proficient with texting and cell phones. Many of our clients will tell us they prefer the text to the email at this point. But remind them of that appointment. It's always good to call 24 hours in advance and just make sure that they're still good. Remind them to bring those items, and it gives them that confidence and that little extra to show up. Because if you don't do that, we also have many clients who maybe aren't completely with it from a memory standpoint, and they will leave you sitting waiting. And not because they're bad people, because they genuinely got confused or they forgot about the meeting. Something came up and they forgot to let you know. And with that in mind, I would also say don't do what some doctors do now. Don't send a million different channels for reminders. They don't need an email reminder, a text reminder, a calendar and invite reminder, and a phone call reminder. Pick the one that you think will work best with the people that you work with. For me and my clients, it's generally a quick phone call. And it's something that you can do. It's a little extra care and it helps make sure that they get in front of you for that meeting. We hope that this session on some things that we do, part one of the enrollment process with a client, was helpful to you. Again, the end goal of this whole project is we will have a 4-part series. Today's topic was before the meeting, and part two, we'll get into the first chunk of that actual meeting face-to-face with the client and how we constructively go over some of their options. So please check that out. And when all 4 parts of this series are finished, we will have this guide that you've seen on the screen available to you as well as TLC affiliate agents. If you're watching this today and you want access to more of our trainings and more of our resources, but you're not an affiliate agent of TLC, please reach out to us. We'd love to talk to you and find out how we can help you in your pursuit of serving this great population of people that we have the privilege of taking care of.